My name is Brenda Watson. I'm Executive Director of Operation Fuel, and I'm here today with Dr. Laura Boese, who is the Director of Programs for the Yale Center on Climate Change and Health, where she leads the center's policy and public health practice work here in Connecticut. She also co-teaches the Clinic in Climate Justice, Climate Policy Law, and Public Health, and is leading development of the new YCCCH Policy Impact Unit. Thank you so much for being here with us today, Laura.
I'm so happy to be here. Thank you for inviting me, Brenda.
Well, we've already experienced, I think, our first heat wave, and it started to get really hot in May, and you've done a lot of work around this area of research. Can you talk to us a little bit about why Connecticut is experiencing more intense periods of extreme heat?
Sure. So we know on a long-term trend that climate change is happening in Connecticut, that we've already seen about 3 degrees Fahrenheit increase since late 1800s. So, and that's more than the average nationally. And so that's an overall increase across the whole year. But as temperatures, as like those averages increase, that also means that we're more likely to have these extreme events. And that will increase in the future. You know, last year, Hartford broke a record for the number of high heat days. So we're seeing these kinds of events happening commonly, and expect them to be, again, more in the future. One point about this heat wave, you know, because it happened so early in the season, it means that it's even more risky for our health because we're not ready for it. Our bodies haven't acclimatized to it. So it felt even hotter than it was, I think, because we just hadn't adjusted. And so that's another issue that we can expect with climate change, is that we'll see more of these hot periods earlier in the season and later in the season.
And how does that impact mental health? So we already know that in the winter months, there's the seasonal affective disorder, or SAD. And that impacts, you know, because there's less sunlight and people are isolated indoors because there's not much activity to do outside. Do you think that the same sort of effect is going to happen in the summer too, where because our bodies are not acclimated to these high heat, because we're Northerners? And do you think that the mental health of folks will be impacted by these increased rounds of heat?
There are studies showing that there's increased violence and aggression that happens with high heat, and you can imagine that too. We get comfortable and other kinds of effects on that kind of aggressive side. I think that there are often spikes in police activity during heat waves. So that's one factor. But you know, we also, I don't know about I can't point to a scientific study on this particularly, but I certainly feel more lethargic in the summertime. So I think it also affects productivity. And I know this is something that was of interest to Operation Fuel. There are studies showing the link between this, you know, hot weather and reduced performance in school. So, you know, kids they can't concentrate, they get really hot, they have trouble paying attention in school, and they have trouble doing well on exams. And there's a relationship between that hot weather, not having air conditioning, or properly weatherized schools, and then lower test performance and learning outcomes.
That makes complete sense, and it gets worse as summer has gotten to be a lot longer, you know, past September, and if folks do not have electricity in a home, that means kids can't really focus on their homework because they can't see in the evening. So that's really astonishing. And very much an interest to us, so that we can kind of build our programs around how to meet that need. So thank you for that. About statewide statistics regarding ER visits, are hospitals tracking how someone is injured, if there's like a burn, or if someone comes in for heat stroke or heat related injury? Are hospitals tracking why? Because perhaps maybe there wasn't electricity in a home, or there was no air conditioning, which caused the patient to go into the ER?
Such a good question. So there's insufficient reporting on heat-related illness. Um, uh, One of the reasons for that is that it's often connected with other kinds of existing chronic conditions or other kinds of issues. It's like an added stressor on the body. And so when someone goes to the emergency department or to the hospital, it's often categorized as it was something else. It was, something kidney renal failure or something else. And it's not listed as heat-related illness. And so the numbers that we have are an undercount. There are scientists who look at, they track the number of total hospitalizations and the temperature that day, and they're able to see that there are little spikes so that we have a sense that it's causing bigger impacts than what's reported. But the other part that you mentioned that is also really important is understanding, what caused it. Was it that they were at home and there wasn't air conditioning? Was it that they were an outdoor worker and they didn't have sufficient breaks and shade? Was it that it's someone experiencing homelessness and they didn't have shelter? There are all of these different factors. And I don't think we have that level of detail. It takes like a much more detailed kind of surveillance system that doesn't exist now. We also don't have data actually on, as far as I know, the number of like households in the state that have air conditioning. So there's some basic pieces that will really help us understand what do we need to do to fix the problem. And we don't have a lot of that information in Connecticut yet.
And it would be great to also overlay the amount of shutoffs in those communities, like looking at maybe a heat map. That would be, I think that would help all of the advocates plus, educational institutions to research this so that we can build better programming around how to serve people during these long stretches of extreme heat. So thank you for that.
Yeah. CIRCA, the Connecticut Institute for Resilience and Climate Adaptation, they're building a number of maps so we can better understand these issues of vulnerability to both flooding and heat. And as I understand, what they've been saying is that the heat map is much more complicated because the factors that make somebody vulnerable to heat are more complex than for flooding. If for flooding, it's more like if you live in an area that's designated as a flood zone, but for heat, it can be, what's the quality of your housing? Can you afford to your electricity? Those kind of more of the individual health factors. Are you older or younger? Do you have a chronic illness? So it's more complicated to identify. And so I think it means we need to give it more attention to make sure that we're creating the right policies and protecting folks.
And I also see a connection in that, we could incorporate public safety into this conversation, because you noted earlier that higher heat temperatures, there's a correlation between that and crime, and that perhaps, there's been this nationwide outpouring of support for defunding the police. But, defunding the police doesn't mean taking away their resources. It means like using some of those resources to help in other areas, like, after school programs and things like that. But what about the environmental type of assistance that public safety could offer out of their budgets by planting more trees and ensuring that I know that there's a connection between wanting to ensure that CCTV cameras can not be blocked by trees and bushes, but there's a way to kind of connect and work together, gathering all of the different advocates and on state agencies so that we can work together on climate change and public safety, as well as health and safety.
Yeah. And a lot of them, you're right, they, you get a lot of bang for your buck, right? If you are doing some of those measures, they're not just addressing heat, they're also addressing air quality and stress and neighborhood cohesion and all of these other kinds of things that make communities safer and more enjoyable to live in.
I agree. So now let's talk a little bit about the energy affordability gap and the loss of electricity and that how that could impact one's health during the summer. Can you just talk a little bit about how these pieces are connected?
Sure. Well, if on the extreme heat piece, um, one of the most sure ways to protect health in a heat wave is air conditioning. Then that's particularly the case for someone who is maybe less mobile and who can't leave their home or is medically vulnerable. So if you lose your power or if your power is shut off during a heat wave, that can be life-threatening. And there are other routes to address it too, with cooling shelters and neighborhood greening and that kind of thing. But for some populations, it's really critical to have that as a public health measure.
Yeah. Yeah, we're looking at opportunities to better serve folks during these long stretches of high temperature. But traditionally our program has always focused on heating assistance because that's how we were, our organization was born. But we are seeing fewer folks seeking fuel assistance and more people seeking electricity during the period of April through October. So we're going to continue to monitor that, and we might make an adjustment to our program season so that we're not suspended or closed during the most, stressful times for people. And Connecticut has the highest home energy rates in the nation. I believe we're in the top 5. So there's definitely a link between people who cannot afford the cost of home energy and not being able to be safe within their homes. And we're also trying to educate folks on the fact that air conditioning is not a luxury. As you noted earlier, it can be life threatening if you don't have one. Do we know what the stats are comparing heat-related deaths and winter-related deaths?
I don't have the numbers offhand, but it's still significantly more in Connecticut for cold-related deaths than heat. But we do expect those numbers to shift as it will continue to get warmer in Connecticut and for those numbers to shift. So it makes sense that much of the resources in Connecticut are still focused on addressing the cold weather season, but we can't ignore this growing issue in the summertime. And on the point of air conditioning as like a luxury, there's a difference between air conditioning as like you have it on so cold that you have to wear a sweater in July kind of air conditioning, and the level that you need during really high heat days to protect your health. And so I think making that distinction that is important.
Right. And can you also talk about the winter deaths? Are people freezing to death in their homes, or are they associated with slip and falls and other types of accidents in the winter?
So I don't have the specific data, but my sense is that it's both, and it's also I think heart attacks are fairly common during winter, extreme cold. If you're out shoveling in snow and you have a heart attack, there are those kinds of circumstances as well.
I see. That makes complete sense. So we're going to kind of wrap it up here, but I wanted to touch on one final thing before we let you go. So we're really excited about the heat pump program that we're rolling out. We're partnering with Neighborhood Housing Services in New Haven, an amazing organization. And I wondered if you could talk a little bit about the benefits of heat pumps.
Sure. Well, I think they're fantastic because, I represent an organization that works on climate change and health. And so we're really concerned about the health effects from climate change and addressing things like extreme heat, but we also don't want to make the issue worse, and we want to solve the issue actually. And so heat pumps are a great solution because they're helping us to address climate change by switching from fuel oil to electricity, and then we're working to make that electricity green, right? Have it come from renewable sources. So it's a key part of that puzzle, and they're also very efficient. And then the other benefit is that they offer both heating and cooling. So if a lot of homes in Connecticut are old and they're not, we have box air conditioners that are quite inefficient. And so this is a way that you can upgrade both systems at the same time, and take advantage of some incentives that are coming from the state to make it more affordable. The other piece that I want to flag, and this is something that we've talked about too, is that there's a really important step beforehand, which is to weatherize the home, so that it is as tight as possible and there isn't a lot of air leakage. It means that you are using your heat pump more efficiently. It keeps your house cooler and warmer, as you know, as the case may be. So it really pays for itself. And the other piece that I'm just starting to understand better is that that's also important. Say you lose your power, say the power goes out. If your home is weatherized, it maintains its temperature for longer during an extreme cold event or an extreme heat event. So that also is a way that it's protecting your health during those kind of extreme weather events, and you lose your power, you're better off in the house than if it weren't weatherized and exposed to the elements. So that's a way, that's another part of it that's really important.
I actually I just learned that today. I'm today years old.
Yeah,
that's great.
I think it's a great opportunity for finding this combination of kind of that climate resilience and mitigation and energy affordability at the same time. I think it's a really hopeful direction to go.
And the one piece for us, the primary reason why we're moving in this direction is because it reduces energy burden. It's one home energy bill versus having a heating bill and an electric bill. And in some cases, multi-family housing units have three sources of energy in their home. It's fuel for heat, gas for cooking, and then electricity. So, you know, we're down the road looking at ways in which we can address those issues, those infrastructure issues for the people that we serve, because in order to meet our climate change goals, we really do need to ensure that folks are not left behind. So I want to thank you so much for taking the time out today to talk with us and educate us further on this issue, you know, how heat and health and climate are all connected, and energy affordability. So I want to thank you again, and let's keep the conversation going. Let's check in a few months and see how the summer went, and if there are any updates on statistics that we can share with all of our friends out there in Operation Fuel Universe, if there is such a thing.
Thanks, Brenda, and thanks for your organization's leadership on this. It's really important.
You're very welcome. Thank you again.